Now, let's all of us give a warm welcome applause to this year's winner of the Move for Her research grant, Dr. Kristin Jorgensen.
Hi, all. It's so great to be here. Thank you for inviting me to participate in this great event, and thank you to the Foundation for Women's Cancer for the generous grant to fund our research. It's an honor to be here.
Thank you so much for joining us. We are super, super excited. Now, of course, I have a couple questions, but first of all, congratulations on this amazing achievement. So to help set the stage, can you please talk about how many women face gynecologic cancer and the unmet need?
As we saw in some of the introductory remarks today, we know that every 5 minutes, a person's diagnosed with one of the 5 gynecologic cancers: cervical cancer, ovarian cancer, uterine or endometrial cancer, vaginal or vulvar cancer. That comes to nearly 110,000 people each year in the United States. These cancers affect people of all ages, from teenagers to those in their 80s. And unfortunately, many are diagnosed in later stages, leading to more than 33,000 people dying of gynecologic cancers each year in the United States. One of the unfortunate reasons that people are diagnosed later in the disease course is that there are many barriers to early detection. Sometimes the symptoms can be vague or mistaken for common things like irritable bowel syndrome, and people may not know to share the symptoms that they're experiencing with their doctor, or may not have access to a gynecologic oncologist with specific expertise.
Interesting. Wow. Well, can you tell us more about what inspired you to do this research and what are you hoping to achieve?
Yeah, I was inspired to do this study because I'm really passionate about health equity and access to high quality cancer care for all. In particular, our study is focusing on finding ways to connect to people and families that may not be connected to care right now, to work to a future where, regardless of a person's race, income, or geography, they can get access to the highest quality care. The research we're doing is designed to address a really important barrier to early detection of cancers, and that's genetic testing for cancer. We know that up to 15% of ovarian and 3% of endometrial cancers are associated with 2 common genetic conditions: hereditary breast and ovarian cancer syndrome, or HBOC, and Lynch syndrome. Unfortunately, less than 1/2 of the people who have these genetic conditions have been identified. And even when they are identified and they share their test results with their relatives, less than half of those relatives get testing, even though we know those relatives are at a 50% risk of having the genetic mutation themselves. So our study is investigating ways of supporting people with genetic mutations and their family members through education, the opportunity for free genetic counseling and testing, and family genetic navigator support, to help see if we can improve communication about genetic testing and genetic conditions within families and improve the rates of family members being tested.
Wow. So what is the potential impact this research could have for patients?
We really hope to move the needle on decreasing cancers that arise from genetic conditions. We have ways to monitor, treat, and prevent these cancers from developing if only we can first identify who has these conditions. We hope patients will see this study and seek to participate with their families, and that future patients and their families will benefit from what we've learned.